Hello and welcome. My name's Maria Brosnan, and I'm sure you're very familiar with me, but I'd like to introduce our very special guest and welcome to Dr. Boon Lim. Welcome, Boon.
Hi, thanks for having me, Maria.
Yeah, it's a pleasure. It's a pleasure. And I need to tell people we're recording this bright and early on a Sunday morning. So a special thank you to you, Boon, for getting up early and making the time to speak to us. We're enormously grateful for that.
You're very welcome.
Yeah, great. So would you like to introduce yourself for our participants?
Yeah, so I'm a consultant cardiologist. I've been a consultant for about 13 years, and I am based at Imperial College London. And my NHS practice is at Hammersmith Hospital predominantly, which is a tertiary large center. And my background is that I've done a PhD in the role of the autonomic nervous system in arrhythmogenesis, which means heart rhythm disturbances. And my interest in how the autonomic nervous system works was peaked then, and that was back in 2006 at Imperial. Um, I'm now the clinical lead for the syncope service, which is fainting. And as part of this service, we provide what we call tilt table testing, where we study the autonomic nervous system in terms of cardiovascular reflex and regulation, heart rate reflexes and regulation, with a beat-to-beat blood pressure monitor and heart rate monitor, which is a finger cuff. And throughout these few years, I've been able to pick out certain patterns in heart rate and blood pressure variations in patients with autonomic dysfunction. And so I became very interested in HeartMath because that's just the way I am. I'm interested in many things, and I really enjoyed the experience training to become a HeartMath coach, and have really in my day-to-day practice started to think about how being emotionally regulated makes me feel. And I think there's a lot around experiential learning that or your own experience
Mhm.
that really feeds into your daily practices. So if a practice that you do daily makes you feel good, you are more inclined to do more and more of it. And if it makes you perform better, sleep better, rest better, motivate yourself better, then you're likely to do more and more of it. And so I've started to become more interested in this aspect of healthcare and health delivery, which is not the simple stuff. When I say simple, I mean the stuff you learn in medical school, in papers, in journals, the evidence base, but also the experiential base and how to motivate change in my patients,
Mm, mm,
starting from a shared experience. So it's a different way of practicing medicine, I think, which is instead of the traditional telling patients that the evidence shows this, it's actually guiding patients through their own journey of experiential learning. And
mm,
this is one of the wonderful things we have with HeartMath, that we can guide patients and, at least in the initial phase, use the devices like the EMWave Pro to demonstrate to patients how their heart rate variability is shifting, and then get patients to center in upon how that makes them feel and behave.
mm.
And that can engender change, right? Because when they feel like that and they practice a session, even if it's a short time, and that makes them behave a bit differently or react to the environment a bit differently, they can improve their healthcare.
Yeah.
So that's my background, and I'm also kind of fairly interested in what you do
Mm.
and the stuff that you do, because I think we're moving along similar lines with a different clientele.
I don't open people's chests, though. That's I think there's a big distinction. But thank you for the acknowledgement, and that the work that we're doing together with our head teachers is important, and it's having an impact. And so you mentioned the autonomic nervous system, and that is something that our students are familiar with, and the sympathetic branch and the parasympathetic branch, and how they work, and how that influences people's heart rate variability and cardiac coherence. So, in your words, could you describe for our viewers what is heart rate variability, just to remind them, and what is cardiac coherence from a cardiologist perspective?
So the heart rate variability essentially is the way to think about how your heart rate varies on a beat-to-beat basis. So if I said, and I'm sure this is familiar, but let me just say it very quickly. If I
Mm.
said to you, how do we measure your heart rate average? You might say, my heart rate is 60 beats per minute. Fine. So over 1 minute, you might imagine with a metronomic heartbeat that you have a heartbeat every single second. Now it turns out that's not how it works. How it works is for the first 5 seconds, you might have a heart rate of, say, 70 beats a minute. And for the next 5 seconds, you might have a heartbeat of 50 beats per minute. But on average, this pattern of slightly going up, going down, going up, and going down, which occurs in a particular frequency or cycle or period of oscillation, that gives you an extent of variability. So you can have 60 beats a minute with these two types of variability. So in the first patient, you might vary these oscillations with your breath in and out between 59 and 61 beats per minute. So the
Mm.
variability of the mean, 60 beats a minute, is just 1 point up and 1 point down. And then
Mm.
you might have another person who has the same mean over the same 1 minute, but who might shoot up to 80 beats a minute and come down to 40 beats a minute.
Yeah.
And because of this average still coming back to 60 beats a minute, that second patient will have a higher heart rate variability.
Mm.
So in a nutshell, that's an easy way to explain it. But the complexity of heart rate variability parameters then comes in because there are broadly two categories, which are time domain and frequency domain. Uh, I don't know, Maria, if I have to go, you want me to go into this because it's pretty complex and technical.
No, I don't think so. I don't think
Good,
so. I think I'd prefer that we keep it on a really practical level so people
fine,
can listen to this and do something with the information because
fine.
intellectually I'd love to hear about that, but maybe that's for another conversation. So you point out something really important there that as a cardiologist, if you were to take somebody's heart rate and they both presented as 60, what is the difference then in somebody's health if it's the variation is tiny, like you described, like 1 beat per minute, or the greater heart rate variability? So what does that imply for their health?
Yeah, so one of the most impressive ways in which you can impair your autonomic nervous system is to get diabetes. And it's interesting because diabetes, you may know, causes a neuropathy. A neuropathy is where the nerves in your system get affected by the high sugar levels chronically, and they become uh, dysfunctional. So the
Mm.
most common nerve that gets dysfunctional is actually the longest nerve in your body that supplies your big toe, for example. And that's why diabetics always have to see somebody to look after their feet. And when the sensory awareness of the feet reduces, diabetics who then step on, say, glass or a rock and cut into their toes don't feel it
Mm.
because the sensory inputs just no longer come up to the brain. And so a diabetic can have an angry, bleeding, inflamed, infected foot and not really recognize that as any pain. And
Mm.
such is the damage to the nerves that supply the sensory information that you are very careful with diabetics to constantly watch their feet, okay?
Mm.
So in the same way, the nervous system that controls our autonomic nervous system's heart rate variability can also be affected by diabetes. And one of the earliest markers of diabetic neuropathy is also when your heart rate variability diminishes. So it's often the case that I see in diabetic patients when you do a continuous heart rate monitor or a Holter monitor, that the heart rates are typically fixed. Typically, a bit higher than usual. So where somebody, when they were non-diabetic, had a heart rate, say, of 60 beats per minute on average, when you have diabetic autonomic neuropathy, your heart rate may be 85 or 90,
Mm.
and it varies very minimally. So it might go from 87 to 93,
Mm.
around that mean of 90. And that is a marker of an abnormal function of your autonomic nervous system in respect to heart rate variability. In other words, the abnormality in the nerve fibers, your autonomic nervous system, can create a reduced heart rate variability. That's not the only reason. If I take the contrarian view, in order to enhance your heart rate variability, and if you think about heart rate variability in the more broader sense of diurnal variation, which means day and night variation, you'll find and you'll know that athletic endurance sport folks, such as people who do triathlons or do Tour de France cycling, have a very, very low resting heart rate at night, sometimes 35,
Mm.
and can push their heart rates up during cycling endurance events to 180. And that is another way to express heart rate variability, right? How
Mm.
high and low you can fluctuate your heart rate. And it is said that when your heart rate is very low at night and can be have a huge reserve for heart rate, that means you can push very high, you are fitter, and your autonomic nervous system is calibrated to allow you to flex your nervous system and
Mm.
your heart rate in such a way to give you what you demand, what you need at the time. And typically, athletic folk have a higher heart rate variability.
And what about people like our head teachers and school leaders that will be watching this that have not through physical, say, fitness, like the example you described, like an athlete, but their autonomic nervous system is under pressure because they're experiencing a lot of stress throughout the day. And so that's creating the dysregulation and I don't know if it's dysfunction in the nervous system, but that's affecting heart rate variability and cardiac coherence, so the rhythm of the heart there. What's the implication of stress rather than fitness on heart rate variability and health?
I'd like to break stress down into two components, and I think it's a very, very important question and very difficult question to answer. But in just breaking it down, acute stress is what we need in day-to-day life, and actually evolutionarily, we need acute stress to flight or to be frightened, to fight or flight. And this is something that, as an animal, let's say you're a gazelle grazing in the savannah and the lion comes out of long grass, you need a very healthy fight or flight because you need your heart rate to push up to as high as it can go so that you increase cardiac output, you increase the supply of oxygen and glucose to the increasing demands of your muscles that need to run for your life or fight for your life. But once you reach your herd, and you're in the security and comfort of your herd and you start grazing again, guess what happens? You turn off completely. And the short-term memory of a gazelle is so good in that it it doesn't forget, but it can put out of its mind the chase that just happened half an hour ago in switching off the sympathetic branch. And so it reaches a very nice variable state. Switch on acute stress, switch off relax. The trouble with modern society and people like us and head teachers living in modern society is that there is never a switch off button. And this is fundamental to the way we understand the impact of chronic long-term stress. So when you use stress, let's qualify it. Acute stress is good. Let's say there's a fire in the school or the fire alarm goes off, or an inspector is coming to inspect your school, and for 3 days you have acute stress. That's normal because you need to react and get your school in shape for the inspection. But after the inspector leaves, if you ruminate for the next 4 weeks until the report is published of something that's completely out of your control, that's as if saying that the stress is gone, but your reactivity, which is internal, you're thinking. If you're the gazelle, you're thinking about the lion still 2 weeks after the chase. That is unhealthy stress and will condition your heart rate variability to not perform at a optimal level because you can never vary it down. You're always on a high. So that's one simple way of explaining the or addressing the question you just asked.
And the net result of that then is wear and tear, right? So if your heart rate is higher than it should be, or your sympathetic nervous system is more activated than it should be, that's wear and tear on the heart. Yeah.
So in a very indirect sense, yes. I can't say that it would directly impact your heart with a few exceptions.
Mm,
Um, and we can discuss these exceptions. There is a chronicity of stress that affects holistically the whole body, and part of what it affects is the heart, sure.
mm,
But
mm,
chronic stress, as you know,
mm,
is an autonomic nervous system state. And the autonomic nervous system transition to a high stress environment will permeate through every single organ system. So I can't say, although I'm a cardiologist, I would like to claim that everything's to do with the heart, but it isn't,
mm,
because people
mm.
who have chronic stress break out in eczema, psoriasis, have headaches, have migraines, they have autoimmune conditions flare up, they have IBS, they have funny susceptibility to pains and aches, they've got aching joints all over, and they have low mood or variable moods and impaired concentration, brain fog. So all these factors are um, an outcome of chronic stress. The heart is one component, because the autonomic nervous system, after all, sits way upstream in the primitive part of the brain that influences all these other organ systems, not only the heart, but everything in your body.
Yeah, for sure. And we do talk about that a lot in our training, how if you are experiencing all of those symptoms that you described, it's because of chronic stress. And I think the focus on our work is around the heart because I guess because it's such a public concern, it's the number one cause of death, in my understanding, in the UK, especially premature death and globally. So it's something well worth addressing. But I completely take your point that it affects everything. And if we need any more inspiration to do something about it, then it's right there. So I want to get back to the heart rate variability and coherence question, because I have questions from colleagues that are very grateful to have the opportunity to ask these to you. So one of the questions is why sometimes they can get coherent very beautifully and achieve high levels of coherence. And sometimes they can't. A particular colleague was absolutely flying, doing well, able to achieve high coherence every day, and then suddenly can't. So that's one part of the question. The other part of the question is for colleagues who are just struggling to get coherent at all. And so you described that diabetes or pre-diabetic conditions could be part of that. But what other reasons could there be in the body that influence people's ability to achieve coherence?
That's an amazing high level question and can be answered on so many levels, including a
Um,
technical one. So if I just take your second question first, what are some of the things that physically will impair your ability to become coherent? I think diabetes is definitely one of them. Couple with that in a less uh, in a more indirect way is lack of fitness. And
mm,
the analogy of the athletic triathlete comes into mind, because the more highly trained you are, the more coherent you can be, or the more HRV you will express,
mm,
and therefore the less fit you are, it may be that you can't achieve coherence so easily. The third one, which is interesting, is something that you might not know about, is ectopic beats. Now, ectopic beats are heartbeats that don't come from your natural pacemaker. And some of us simply have a few more ectopic beats than others. And when you have ectopic beats, the coherence measure as the beat to beat heart rate variability is really skewed. And so you may not ever be able to achieve high coherence, although you might have a coherent feeling inside.
mm,
And that's challenging. That's challenging, I guess, for your head teachers who have topics, and it's challenging for you as well as a trainer trying to inspire people to look at this chart going up and down and the coherence value going from whatever red to green to blue to
mm,
green. And so if you really, really struggle all the time, it may be worth seeing a cardiologist or maybe worth getting a pulse check. And sometimes the isolated pulse check may not tell the whole story. You might need a Holter monitor. You might need to see how many ectopic beats you have in a 24-hour period. Okay, so that's the kind of thing to just put to one
mm,
side.
mm,
Coming
mm.
back to the other reasons, in a sense that we can all understand why people don't have coherence. If I said to you, Maria, that one of the fundamental ways in which you entrain your parasympathetic nervous system is through breath. And we all do this breath work, breathing deep, diaphragmatic, ideally nasal, breathing slow, rhythmic. And when we do this breath work, we actually train our reflexes. There are stretch receptors in our lungs that feed in directly, which are called the respiratory cardio reflexes, feed into the heart rate variability in the heart. So the first element of coherence is to have a regular rhythmic breathing pattern. Okay. And that is what we all learn. But I imagine what you are talking about, Maria, is in the presence of the same rhythmic breath pattern,
Yeah,
why sometimes I can and sometimes I cannot get. So let's
exactly.
assume that you are breathing in the way that you normally breathe to get coherence. And then the one time out of 10, you can't. The most common reason for that is alcohol, in my opinion, and in my experience. When
Mm,
you have alcohol, and this is not alcohol acutely, this is alcohol the night before, it
mm,
may be challenging to settle your autonomic nervous system
mm,
because alcohol impairs sleep, rest, recovery, and you might not feel it directly, but it will have an impact. And I know this because people who wear trackers such as the Aura Ring, Circular Ring, or a Fitbit or an Apple Watch often find consistent HRV levels. And then on the Friday and Saturday night when they drink,
mm,
although they feel perfectly fine
mm,
and they may get more sleep actually on those days, on the weekend, the HRV drops.
mm,
And this is something that may impact you for the subsequent day. Okay, so that's number one. Number two, your state of autonomic calm as far as your stress response is. And so if you're ruminating still about that inspection to come, and that's not a 1 day acute stress, that's a 3 or 1 week acute stress, let's say, because he's coming next week, then you may not be able to get coherence so quickly because the second component that enhances coherence is what the state of your autonomic nervous system is. And I think the two ways to think about it is you have a triangle, bottom and top. So the bottom up approach to achieve coherence is through breathing. Physiological change in
mm,
breathing will come up and influence the coherence. But there is a top down approach, which is how your thoughts, your feelings are. And these are often subconscious feelings, i.e., an inherent fear of something,
mm,
of a publication or of an inspection or of your own children sitting for 11 plus exams. And that subconscious feelings also affect coherence.
mm,
And as you
mm,
know from your heart math training, the way we really get the best coherence possible is to breathe in this regular rhythmic way, but also to express a positive emotion. And
mm,
the emotional component is what I call the top-down approach, where a thought or feeling can improve your coherence. Hence, when you are dysregulated in your thoughts and feelings, you might still be able to take control of your breath, but your coherence won't be anywhere near as high.
mm. Thank you. Yeah, it can be so frustrating for people, for myself included. There are times where I just can't go get coherent, and most of the time I can figure out why, and it's usually around food. So if I've just eaten, then I can't get coherent at all, or if for other reasons, typically around food for me, and but
So
sometimes I
that's
just don't know.
that's interesting, and it's something that I missed. So food and the impact of food on starting up the digestion process really makes you skewed one way.
Mm,
And the way that it makes you skewed is parasympathetic. And you can, all of you listening can try this experiment. Instead of having your normal light lunch, go crazy. Like go for a nice pasta bake served at the canteen, followed by a nice dessert, super rich apple crumble, and then top it off with ice cream or a brownie. Now, don't do this every day, just do this for the experiment. What you will find is 2 hours later or an hour and a half later, you get this slump, incredible sleepiness, drowsiness. You can't even stay awake in front of your PC, let alone your class. So your class, let alone your PC. And one of the things that happens when you eat, especially when you eat particularly kind of dense carbohydrate food stuff, is that you have to wick away the nutrients that are starting to be digested. And so food is an energy consuming process. You don't know this, you don't think this. That's why they say don't eat so soon before, don't eat so close to the bedtime
mm, mm,
because it makes your sleep very disturbed as well. And it's because eating is an energy consuming activity, and you need to shift your autonomic nervous system to vasodilate and to take away the nutrients. And when the autonomic nervous system is primed in a mode of having to act in one way or another, it's very difficult to achieve coherence. So if you're running away from a saber-toothed cat, it's easy to explain, but eating may not be that easy to explain, but it is a autonomic trigger that shifts the balance of coherence.
Yeah, yeah. And I think, are there times, I wonder if people have like a low-level virus or something, again, as you described, you might not feel it, because there's a particular person that I'm thinking of, and he just, all of the examples that you gave, he's not feeling stressed, he's doing everything that he would normally do, but just can't achieve coherence at the moment. And and he can't see a reason for it. I can't see a reason for it. Could there be something else happening physiologically, like a?
So it's worth checking for ectopic beat, so he can just feel his pulse for maybe 2 minutes, and feel whether it's dead on regular. I said earlier on that you might vary, let's say, in extreme case, from 40 to 80 beats a minute, around a mean of 60. Now, to feel that would be quite difficult because you're slow, fast. The key thing about ectopics is that the slow is not and the fast are not occurring in sync. So in the first normal example of a very healthy heart rate variability, you might feel slow, slow, faster, 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 slower, 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 slower. In the ectopic beats, you will get this fast, slow variation, but on top of that, you'll get something out of the ordinary. It just goes lub dub, lub dub, lub dub, lub dub, and then typically a pause after your ectopic beat, and then it starts again, lub dub, lub dub, lub dub, lub dub. That extra beat that is not in sync with the gradual up and down is likely to be an ectopic beat, and that could shift that person's coherence and never make it and never allow it to come up. You mentioned at the beginning, which I thought is what you're going to say about this gentleman, subclinical viral illness, and the answer is yes. When you have a subclinical viral illness, it's an autonomic stress as well, and can impair your ability to achieve coherence. Absolutely right.
So, as I'm very aware of time, and I'm so grateful for you spending so much time with us, Boon, I just wanted to just talk about one more theme, and that is about genetics. And one of our heads asked, he said, my father died of heart disease when he was 49 and I'm 48. He said, I'm worried, should I be? And just as a little bit more context, his father worked in a job that had very high exposure to toxins, and he had emphysema. So how much of people's concerns about heart disease, that it's been in the family, that it's genetic, how much of that is important, and how much of the things that we're talking about, being able to regulate your own nervous system, what is more important, or are they both equally important? Keeping Your Heart Healthy by Boon Lim. Dr. Boon Lim.
It's a layperson's written book. It's a Penguin kind of life expert commission book, and I wrote it last year. And actually, the answer is quite short for me because I'm not able to go into the book. But if you really want to know, buy the book and read the chapter on coronary artery disease and cholesterol. But essentially, the factors that give you a risk of heart disease are diabetes, hypertension, hypercholesterolemia, a family history of heart disease, and I would say in there stress as well. And one of the stresses that I can see this gentleman having is the stress of his own mortality as he gets to the magic threshold that his father passed away, which is 1 year from now. And this stress is so acute that I have to share a story, Maria, that I haven't shared online yet. I was doing a ward run at Christmas time where I was covering the wards, and this chap comes in from the Netherlands on a holiday, ostensibly to have a good time with his kids, who are teenage kids. And he comes in with the most unusual presentation of a cardiac arrest. So he takes a pee one morning, comes back to his hotel room, and collapses onto the floor in a hard fall. The daughter, thankfully, has learned CPR in her school, and she gives him CPR and saves his life. He comes to the hospital and has essentially a normal angiogram. A normal angiogram means his arteries are clear. And yet, on the MRI scan, he's got a very clear pattern of having had a heart attack. So having a heart attack with a normal angiogram is a very unusual pattern that we see. Maybe I've only seen 2 or 3 of this in my lifetime. And we debate amongst 12 cardiologists about what the heck happened to this guy. No explanation. And in the end, we put an implantable defibrillator in him because ultimately the episode in the bathroom would have killed him.
Mm.
And it turns out on the day of discharge, when I come round on my rounds and I say, look, sir, I really cannot explain it. There's nothing in your lifestyle or risk factors that could point towards a risk of heart attack. And yet it would appear you have a heart attack, but your angiogram is normal. So I don't really know what to do, but you're protected now from the next one because you have an ICD. He says, thank you so much. And then I ask him something more, which is, did he have any stress? And he said, subconsciously, my father died at an age which I am now in front of me.
Oh,
Nothing to do with the heart, died of brain cancer, yeah?
wow.
And he didn't want, and I said, so therefore you've reached this age, what are you afraid of? He said, I'm afraid of letting my teenage daughters go without giving them adequate care and attention. I'm not prepared them for life. And to my mind, that was a kind of the only thing I could hang my hat on. So when the evidence and the science has all failed to give an explanation,
Mm.
I think on the last day, I said to him, and I kind of held onto his arm and I said, look, it's all okay. You can let it go. You don't have a brain tumor and you can let it go. And he just let out this most, I would say, cathartic, emotional outburst
Mm.
where he cried and he was sobbing and crying for
Mm.
about 3 minutes continuously,
Mm.
very loudly. And that was the first time he'd ever let out this subconscious emotional stress for the entirety of his life. Not life, but ever since he had children.
Mm.
Because then I asked him a question, you really miss your dad? And did you felt you didn't have enough time, although he had brain tumor and his death was coming? He said, yes, I needed him for a bit longer in life. And I think that same feeling resonated with him throughout his life and culminated in him having and manifesting an event on the anniversary on the same age as his
Oh,
father would have left him.
mm.
And that was the only explanation that made sense in his mind. So when science can't explain things, i.e., you've done all the tests, you can't
Mm.
really find anything, you've discussed it with all the clever cardiologists at Imperial, you can't understand. At least giving the patient, I may be wrong, it might be nothing to do with that, but to him, it is right. And his emotional release, I think, means that he goes back to Holland a different person emotionally. And although
Mm.
he's had a negative event, he can now live life without fear.
Mm. Mm.
Um, and your and coming back to the story about your head teacher, who I hope is listening, don't live in fear. We
Mm.
should live life uh, with ultimate abundance. And ultimate expression of abundance is fearlessness. And the ultimate expression of self-love is to care for self. That means practice what Maria has taught you, but also in your day-to-day life, wake up with a gratitude exercise and practice that because there's nothing to fear in life. And you can only do the best of your ability in whichever field that you do. And once you've done that and know that you've given your best, what else is there to fear? There's nothing to fear.
I could talk to you all day, Boon. Thank you so much for your time. It feels like a natural and beautiful way to end our conversation, unless there's anything else that you would like to say, any last words of wisdom, but they were absolutely beautiful.
No, that's fine. Thank you for having me. And
Yeah,
I wish you and your head teachers all and your school leaders all the very best in your journey forwards.
thank you.
The only other thing to say is that these techniques that you learn from Maria can be easily translated to your peers. And the way I think about making a change, and you are in such a position to change, is through a ripple effect, which is from the ground up and not from the top down. You're in a unique position at the top of your food chain in your school to be able to make this change. And I would suggest make a change in your family members and make a change in your deputy head, and then in your science or in all your leads, and then in the classes that you teach, in the pupils that you do. So it is an experiential change, which means that you sit with somebody one-on-one, like Maria has sat with you, and you feel it. And then you say, pay it forward. And this is how we change the school system, not a diktat from up top or the government, but from down below. And that's what I'm doing with my patients as well. So good luck with that. It's a challenge that is very well worth embracing, because I'm sorry to ramble, but I think this is a very important point. Many medical schools who have come out, some of the people and pupils you are most proud of coming out of your school education system, they come into my system, i.e. as a medic, and they fail emotionally. And I'm sorry to say this, but the academically gifted children who get 5 A's or who get whatever 45 at IB, and they get into medical school at Imperial, where I teach, or at Oxbridge, and they go into this very intense course, medicine, for a very long time, 5 or 6 years, they can come out the other side without any emotional regulation, and they're broken by the 3rd year of practice, sometimes even the 1st year of practice. And this is something that I find at my end, because I pick them up after they've graduated and sometimes I pick them up 4 or 5 years after they've gone through their basic training into cardiology registrar training. And it's very difficult to fix then. For me to help somebody at the age of 27 is a bit more challenging. For you to help guide them when they're open to your nurturing is a very realistic possibility. So I would urge you, if you felt the change internally, experientially, make that part of your guidance and education, your pastoral care, and perhaps introduce a component of emotional self-regulation in teaching your students to deal with adversity, because they will have adversity. However bright they are academically, when they see the first patient shout at them, struggling, the first complaint, the seniors being very harsh on them, in whichever discipline they go into, the resilience and the reaction to the external environment, the stress manifestation, is what some of the junior doctors under my charge lack, and is not part of our curriculum either. So you might as well bring it down early. You might as well introduce that early. So that would be my parting shot. Try and make that part of your curriculum.
That's definitely what we're working on, definitely. And I invite our heads throughout the program together to teach in assembly, to teach at a staff meeting, to exactly do as you described, because it has to ripple out from our heads. And they create the weather in the schools, you know, they create the school culture. And I'll talk to you directly, you know, you have the power to make an enormous change for the people, as Boon just beautifully described. So thank you to our heads for watching, for all the work that you do, and especially thank you so much, Dr. Boon Lim, for being with us today and for your incredible insights. Thank you so much.
You're very welcome. All the best. Have a good day.
I'm gonna